Welcome to this deep dive. We're jumping straight into a field that's so vital, but honestly can feel incredibly daunting to navigate: psychiatry.
Oh, absolutely.
Mm.
It's just got immense depth, doesn't it? And it's always evolving, which, well, makes it a real challenge for anyone trying to get a solid handle on it.
Yeah, especially if you're maybe just starting out or you need to get up to speed on key concepts quickly.
Right.
And to help us, cut through some of that complexity, our focus today is on source material that highlights a specific resource. It's called 100 Questions and Answers in Psychiatry by Dr. Atef Ahmed.
Okay, yeah. So we're going to take these source excerpts we have and really unpack what they tell us about this book.
Exactly. What makes it stand out? How is it structured?
And importantly, why did the sources seem to describe it as, well, particularly valuable for learners, people who need to get informed without getting totally overwhelmed?
Mm-hmm. Our mission here is to see how a resource like this, at least as it's described in the source material, kind of positions itself as a shortcut, maybe, to understanding a complex field. So let's dig in.
Let's do it.
So straight off, the source material introduces the book 100 Questions and Answers in Psychiatry, and the author, Dr. Atef Ahmed.
Yeah, and it doesn't just give the name. It specifically describes him as a seasoned and esteemed medical educator.
Right, that feels important.
It really does. It suggests the book's approach isn't just academic. It's shaped by, actual teaching experience, years of it, presumably.
And the sources, they use some pretty strong language about the book itself. I saw things like Masterful Guide, essential resource.
Even a beacon of knowledge.
Yeah, it really sounds like the source authors view this book as a pretty significant tool for learning psychiatry.
But what's really interesting, I think, is how it aims to deliver that knowledge.
Mhm.
The source makes a big deal about its engaging Q&A format.
Right, and it's presented not just as like a style choice. The sources suggest it's actually designed to boost learning and, crucially, retention.
Exactly. It kind of flips the script on traditional learning, doesn't it?
It does. Instead of, read a chapter, then test yourself, the material is presented as questions right from the start, with these comprehensive answers.
Which, as the source points out, makes it useful for a couple of things. Like maybe a quick review if you need a refresher before seeing a patient.
Or for deeper, more structured study if you've got more time.
And the sources really stress that the answers aren't just short definitions. They come with detailed explanations.
Which suggests the goal isn't just rote memorization, right? It's about fostering critical thinking.
Precisely. You can imagine how that format might help. Like if you're tackling a complex diagnosis, maybe the Q&A walks you through why certain symptoms point one way or another.
Or how criteria are actually applied in the real world.
Yeah, it helps you understand the reasoning. Sources seem to imply, not just memorize the facts.
Okay, so what about the scope? What ground does the book actually cover? The source material mentions comprehensive coverage.
Yeah, it sounds pretty broad. It apparently starts with the fundamental principles, the basic building blocks.
Okay, the foundation.
Then it moves into really crucial stuff like diagnostic criteria, how conditions are actually identified formally.
Which is obviously key.
Absolutely. And then it covers the latest treatment modalities.
Oh, that's huge. That field changes so fast.
It does. And the source suggests the book really brings you up to date. It includes contemporary research findings and sort of the evolving perspectives in psychiatric practice today.
It sounds like it's really trying to connect that foundational knowledge with what's happening right now in the field.
That seems to be the idea. And the sources link a lot of this back to the author's background.
Right. They specifically mention Dr. Atef Ahmed's extensive clinical experience and pedagogical expertise.
And that combination, well, it can be really powerful, can it?
Yeah.
The sources explain that his clinical background means he can offer these nuanced insights into conditions, understanding them beyond just the DSM definition, maybe how they actually look in real patients.
And the teaching side.
Well, the pedagogical expertise means he presumably knows how to package all that complex information so it actually makes sense to students, so it clicks.
Okay, so that's how the source suggests it offers those real-world application that I mentioned.
Exactly.
This feels really relevant for you, the listener, especially if you're looking for ways to grasp these complex topics quickly, thoroughly, but without feeling completely swamped.
Definitely. I mean, a resource designed by someone who gets both the clinical reality and the learning process. That could make a big difference.
So who is this actually for? The sources are pretty specific here.
They are. They call it a vital resource for aspiring psychiatrists, saying it provides that solid foundation.
But they also make a point of saying it's invaluable for all medical students.
Which makes sense, right? Mental health touches everything in medicine. Understanding it is crucial no matter what specialty you end up in.
Absolutely. And then, maybe most practically for a lot of learners, the sources flag it as an excellent tool for comprehensive exam preparation.
Yeah, things like board exams or other professional qualifications, they suggest the format, that Q&A structure, and the breadth of content are really well suited for that kind of intense review.
And the sources keep coming back to this idea of practical understanding. They say it's not just presenting facts.
Right. They mentioned it uses real-world scenarios, maybe case-based discussions, things designed to get students ready for actual clinical rotations.
Ready to interact with patients, bridging that gap between the textbook and the clinic.
That seems to be the core promise, based on the source material.
It's interesting, too, how the sources describe the book's feel, almost. They go beyond just calling it a study aid.
Yeah, that phrasing, more than just a textbook, stood out to me too.
What else did they say? Something about a journey.
Yes, they called it a journey into the heart of mental health.
That implies something deeper than just learning facts for an exam.
It really does. It suggests a level of engagement.
And they even describe it as a source of inspiration. Crafted, apparently, not just to elevate understanding, but to ignite a lifelong passion for psychiatry.
Which is, a pretty ambitious goal for a textbook, even a Q&A one.
It is. It suggests the book aims to connect with the learner on more than just an intellectual level.
Okay, so if we step back and look at Dr. Atef Ahmed's 100 Questions and Answers in Psychiatry through the lens of these source materials, what's the main takeaway here?
Well, the sources paint a picture of a book really designed with the learner front and center. That Q&A format isn't just structure, it's presented as a core learning mechanism.
Yeah, a mechanism designed for better understanding and remembering complex stuff.
And they highlight the comprehensive content, covering the essentials but also the latest developments.
All brought together, apparently, by an author who has both deep clinical experience and knows how to teach. That seems key.
Aimed specifically at closing that gap between theory and what actually happens in practice, helping students prepare for exams, yes, but also for clinical work itself.
And you can see how sources like this, structured in such a learner-focused way, could genuinely act as that kind of shortcut we talked about. A way to get reliably informed in a really challenging field like psychiatry.
So here's something to think about. How might a resource like this one, that's built around answering specific questions, covers everything from fundamental principles to the latest research, and weaves in ethical considerations, all framed by practical experience? How might that fundamentally change the way you or anyone approaches learning about something as intricate and, frankly, as human as mental health?